Back to our top story tonight, and that is the ban on the importation of vaccines by private companies. So now that the government has told us that it alone is the sole agent when it comes to vaccines, and says only vaccines that have been approved both by the WHO and the Pharmacy and Poisons Board are allowed for use in the country, what happens to those who'd already received the Sputnik V vaccine? I understand it is 2 doses as well as such as the AstraZeneca vaccine. Anita Nkonge tells us what the Cabinet Secretary for Health, Mutahi Kagwe, had to say on the subject.
It has been a murky conversation, that of the acquisition of COVID-19 vaccines through private entities with concerns over low accountability and possible exploitation. Now the government has put its foot down.
The government is effective today, closing the window of private sector importation, distribution, and administration of vaccines until such a time when it is confident that there is greater transparency and accountability in the entire process in the interest of public health safety. There will be no licensing of private players in the importation of vaccines, and any such license given will be and is hereby terminated.
This is a statement seen to be largely aimed at the Russian vaccine Sputnik V, which was brought into the country through a private company.
If a vaccine has not been cleared by the World Health Organization, it will not be used in Kenya, whether it is being used in other countries or not. The second window one that had been introduced in Kenya is cleared by PPB, but not yet cleared at the World Health Organization.
However, this, if not cleared, would leave uncertainty on the part of those who have received the jab, as they are expecting a second dose.
The government assures those who have already taken their first dose of vaccines outside the government deployment plan by this date will receive their dose when due.
Some people have been unable to secure a shot of the free-of-charge AstraZeneca and have had to pay for alternative vaccines, or even AstraZeneca itself. But
any person advertising or vaccinating people for a fee will therefore be in contravention of Pharmacy and Poisons Board regulations.
The Africa Center for Disease and Control has been saying the very same thing that the government has announced.
Acquisition of vaccines at this stage should really be the government's responsibility. It should not be allowed to be given to the private sector, because vaccines are very scarce globally. And as soon as we remove our ability to negotiate together, the prices will go up. And when the prices go up, not only will the individuals not be able to afford it, even governments will not be able to afford it.
Questions have arisen, however, on whether the government can single-handedly cope with the demand for the importation and distribution of the vaccines. Anita Nkonge, NTV.